Good evening, everybody. Okay. What are some of the things you need to know about your medications? As a pharmacist, I'm often questioned by both healthcare professionals as well as patients on certain handling procedures. How do you handle your medications? What are some of the things that you should know about medication adverse events? What are drug interactions? What exactly does an expiration date mean? How do you properly store your medications? Properly dispose of your expired or unused medications, as well as one of the questions we get often is, what is a generic drug? How does it compare to a brand product? Over-the-counter medications, how do you safely handle over-the-counter medications, as well as how do you safely administer medications in the home? How do you keep your family safe when handling medications? An adverse drug event is an injury resulting from medications. This can include a medication error, an allergic reaction, an adverse drug reaction, or an overdose. Adverse drug events can happen anywhere. They can happen at a doctor's office, they can happen at a hospital, they can happen during your visit at an emergency room visit, as well as the home. According to the Centers for Disease Control, adverse drug events is considered a public health problem. 82% of adults take at least one medication. 29% take 5 or more medications. I want to note that as the number of medications you're taking increases, this also increases your risk of an adverse drug event. We'll get into more detail during the course of the lecture. $3.5 billion is spent on the extra medical costs incurred by adverse drug events annually. And at least 40% of the ambulatory adverse drug events are preventable. Hopefully at the end of this lecture, you'd have some information, you'll be equipped with the necessary tools to prevent adverse drug events at the home. An adverse drug event is an injury resulting from medications. This includes, an adverse drug event, as I mentioned, according to the National Centers for Healthcare Statistics and the Centers for Disease Control, drugs now kill more people than cars and guns. If you notice, the solid line here depicts the increase in the incidence of drug overdoses. These overdoses can be intentional or they can be unintentional. An unintentional overdose would mean that there's some harm, the harm that is caused to you was not intended. An intentional overdose would be in the form of a suicide. Car accidents and shootings have declined compared to adverse drug events. What are some of the things that you should know to prevent adverse drug events? Ensure that your physician and pharmacist has a complete list of your medications. This is important because when making decisions about your drug therapy, if your physician has a detailed drug history, he or she can prescribe the necessary or safe regimen or the options that are safe for you. Use one pharmacy to fill all of your medications. Just an example, if your physician gives you a prescription and you fill your medications at pharmacy A, you then, within the next few months, you filled another prescription at pharmacy B, and then you visit pharmacy C to fill a prescription. Unless it's a chained pharmacy, the information at all 3 pharmacies are not connected. So when you're refilling your medications, especially if these are chronic drug therapies, that pharmacist at each pharmacy will have no idea what you're taking at the other pharmacies unless you present them with a complete list. So if you can avoid filling your medications at multiple pharmacies, please do so. Take advantage of pharmacist consultations. The pharmacist is your drug expert. Who better to ask about your drug therapy than a pharmacist? So when you're dispensed a medication, do not leave the pharmacy unless your questions are answered and you've been counseled by a pharmacist. Limit how often you use over-the-counter medications. Over-the-counter medications, while you do not need a prescription for them, they can pose harm just like the prescribed medication. So if you can limit the amount of over-the-counter medications you're administering to your family or yourself, please do that as well. If you take any prescription medicines, ask your doctor or pharmacist before you add an over-the-counter medication to your drug regimen. I'll get into what drug interactions are during the course of the lecture, but just note that over-the-counter medications can pose the same risk to drug interactions as prescribed medications. Read the drug fact label on the medication very carefully, whether it's an over-the-counter medication or whether it's a prescribed drug. Most times when you're dispensed a medication from a pharmacy, there's a label that's placed on that medication along with auxiliary labels. You see the pink and the red and the green labels. These are all instructions to you to keep you safe. When you purchase an over-the-counter medication, the back of the bottle or the box has specific information that can guide you on the safe handling of your medication. So always read that information very carefully. Ask your doctor or pharmacist if the information about your medication is unclear. According to the American Society of Health System Pharmacists, studies have shown that patients that are empowered about their medications, patients that have received adequate information about their medications, their outcomes tend to be much better than patients who have no idea why they're taking their medications. Do not leave your physician's office if you have questions or uncertainties about your medication. Do not leave your pharmacy unless you've asked your pharmacist about your medications. Take medications exactly as directed. The instructions on your label are not only to ensure that you complete the entire regimen, but it's also to ensure that you are safe while taking your medications. Do not take medications that have not been prescribed for you. This is very important. A lot of times your friends or your family members may present with the same symptoms or signs, and you'll be like, okay, I have some antibiotics here, you can use this, or I have some pain medications that you can use. Never share your prescribed medications with your family members or anyone for that matter. Do not take vitamin pills and minerals along with your medications unless you've gotten authorization from your physician or your pharmacist. I say that because a lot of times the over-the-counter multivitamins can interact with your drugs. And I'll explain to you exactly what a drug-drug interaction is. So before you start taking any medication along with a prescribed drug, always speak to a healthcare professional, particularly your prescribing physician or your pharmacist. When giving medicines to children and the elderly, use the correct measuring device, okay? Sorry. What are drug interactions? That's one of the questions that we get a lot in the pharmacy from both physicians as well as patients. A drug interaction may make your drug less effective. It may cause an unexpected side effect or increase the action of a particular drug. In some instances, a drug interaction can also decrease the effects of certain drugs. Some interactions can even be harmful to you. Frequently asked questions by patients as well as physicians about drug interactions would be, what are drug-drug interactions? A drug-drug interaction occurs when a patient is taking 2 or more medications at the same time, and the drugs act on each other in a way that it causes an unexpected effect. For example, if you're taking a drug and you add a second drug to that regimen, that second drug can either increase the effects of that first drug or decrease the effect of that drug. And that's what we call a drug-drug interaction. While some of them may be beneficial to you, some of them can be harmful. So it's very important that you know what you are taking and you know of the possibilities of a drug interaction. Drug food or drug beverage interactions are common as well. What exactly are they? This is when you take a drug and you've added food to your regimen. For example, you take a drug at a certain time and you consume or you ingest food or you drink, for example, alcohol. Alcohol is a common beverage that interacts with a lot of medications. So on the label of your prescribed medication or on the label of your over-the-counter medication, you'd always see, do not drink alcohol. There's a reason for that. Because for the antihistamines, if you're taking an antihistamine that causes drowsiness and you consume alcohol, what happens is that drowsy effect is potentiated and sometimes it can harm you. Or if you're taking a certain medication and you consume alcohol, you can damage the liver. So all food-drug interactions are not good. Then sometimes you'd see on the label, take after a meal. Some food interactions are actually beneficial and then some can be detrimental to you. What is a drug-condition interaction? Or in some cases, in the pharmacy setting, we describe it as being a drug-disease interaction. As simple as it can be, it is an interaction that occurs when you take a drug and you have a known medical condition. A cold and cough preparation has a decongestant in it. And most times, when you have hypertensive patients taking these medications, it can elevate the blood pressure. This is what we call a drug disease or a drug condition interaction. It is very important, as I've mentioned before, to always consult your pharmacist or your physician before adding any drug to your regimen. How can you avoid interactions? There are a few steps that you can follow. Always know the active ingredients of your medication. Whether they're over-the-counter medications, prescribed medications, know exactly what you're taking. The over-the-counter label has specific instructions at the back. When you're dispensed medications at the pharmacy, the pharmacist will give you specific instructions as well. Always read and follow these instructions. How do you check? How do you know whether or not a medication can cause an interaction? Your pharmacist is your reference point. He or she is your drug expert. He or she can answer these questions for you. What does an expiration date mean? How does it affect your medications? Medications are very expensive. Some medications are very expensive, and most patients, to avoid an expensive doctor's visit or to avoid refilling an expensive drug, tend to take medications after the expiration dates have passed. In 1979, U.S. law mandated that the manufacturers indicate the expiration date on their products. This is the date at which the manufacturer can guarantee that the drug is still effective or still has potency to exert its pharmacological effect. Drug expiration dates exist not only on prescribed or prescription medications, they also exist on over-the-counter medications as well as dietary and herbal supplements. While there are some drugs that you can take after the expiration date has passed, I want to note to you that do not take any drug that has expired unless you've gained authorization by your physician or you've spoken to your pharmacist. Because some drugs, when taken after the expiration date, can harm you or they can be ineffective. Certain formulations of medications, some tablets can be taken after the expiration date only when you've gathered authorization. And then some antibiotic suspensions, any antibiotic or any drug that needs to be reconstituted, the stability of that drug is not the same as an expired tablets. So you would want to definitely avoid taking these drugs after the expiration date has passed. Pretty much an expiration date, once a drug has reached its expiration date, what happens is that drug gradually decreases in potency. So you start off at let's say for example, 100%. Over time, a drug loses or diminishes in its effectiveness. And once that drug has passed the expiration date, that drug is not as effective as a drug that hasn't been expired as yet. So you'd always want to check. Certain drugs you will avoid taking after the expiration date. Drugs that are used to treat epilepsy, do not ingest or consume these drugs after the expiration dates have passed. Certain cardiovascular drugs, nitroglycerin, anticoagulants, warfarin, you'd avoid taking after the expiration dates have passed. digoxin, another cardiovascular drug, thyroid preparations. All thyroid preparations do not ingest after the expiration dates have passed. Oral contraceptives, insulins, as well as eye drops you'd want to avoid as well. Yes. Oxygen, light, water are among the substances that humans need to survive. When we're storing medications, these are the elements that you'd want to avoid coming into contact with your medications. However, these same elements can degrade your medications according to the Food and Drug Administration. Exposure of medications to inappropriate conditions may render them ineffective, as I've mentioned, or even harmful if ingested. Every medication has its own specific instructions as it relates to storage. The manufacturer would set this parameter. Certain medications would require refrigeration. Certain medications, some vaccines require freezing. Some medications require that they be stored at room temperature. And if these medications are stored outside of the recommended environment, they can be ineffective. Some of the questions we get would be, can you store tablets in a medicine cabinet in the bathroom? Because of the extremes in temperatures and humidity, it is not advised to store your medications in the bathroom because they can degrade. And that's one of the #1 places patients tend to store their medications. Avoid storing your medications in the bathroom due to the humidity. Also, medications come in specific containers. Some medication containers you'd see are clear, some are opaque, some tablets are in foiled packages. These are all for reasons based on the stability, maintaining the stability of the product. So when a product or a medication is dispensed to you, always keep that medication in that container, or if possible, the original container. How do you dispose of unused or expired medications? Okay. If there isn't a program in your community that actually collects your medications, or you don't have a pharmacy that collects your medications, there are some things that you should know about the proper disposal of your medications. According to the Food and Drug Administration, as well as the World Health Organizations, do not flush medications down the toilet. Do not pour medications down the drain. However, some medications, according to the manufacturer, because of the nature of that medication and the possibility of the wrong person consuming or ingesting that medication, some of the manufacturers would suggest that you can flush medications down the drain. But there are some environmental factors that take place as well. But for the most part, if you can avoid it, do not flush or dispose of your medications down the drain. There are a few things that you can do to ensure that your medications are disposed of properly in the home. Do not crush your medications. Keep medications in the original container. Remove or blacken out, de-identify the personal information on your medication container, but leave the name of the drug as well as the dose of the drug on the container. Add a safe and palatable substance such as kitty litter, dirt, or coffee grounds to the medication. This is all before you're disposing of the medications in the trash. And then place the medication in a sealed bag and dispose of it in the trash. The reason you're doing this is to ensure that if the medication gets into the wrong hands, if, for example, it gets into the hands of a child or a pet, the unpalatable substance would cause a diversion, and those persons or that pet would not consume the medication. So it's more so in terms of keeping your family safe when disposing medications. If you can, dispose of the medication as close to trash day as possible. What are generic drugs? And how do they compare to branded products? Generic drugs should be safe, they should be effective, and in most cases, they should all have the same active ingredient as the brand product. Generic drugs are required to have the same dosage strength, dosage form, as well as active ingredients. The generic manufacturer, a company that manufactures generic drugs, must prove to the regulatory bodies such as the Food and Drug Administration as well as the World Health Organization that its product is bioequivalent to the brand. What does this mean? Certain products are bioequivalent to certain generic products are deemed bioequivalent to the brand products if certain parameters are met. One, it should have the exact active ingredient. It should have the same safety and efficacy profile as the brand product. It should also have the same pharmacokinetic profile. And that basically means if you take a generic drug and you take a brand drug, if you test a person's blood level, there should be the same amount of drug levels in the blood when you compare both of them. A drug is not deemed bioequivalent unless it meets these standards. And there are regulatory bodies that ensure that the generic drugs that are produced or that are manufactured meet these standards. A lot of times we see that generic drugs there's a significant difference in the cost of generic drugs compared to branded products. Some generic drugs cost 80 to 85% lower than a brand product. I want to make a note that the manufacturers of the brand products are sometimes the same manufacturer of the generic product. Yes. When a drug is manufactured, a product has a patent that's set on that drug. Once that patent has expired, companies can now manufacture that same drug. But there are some regulations that they do not manufacture the drug during the patent of the branded product. The difference in the price of brand and generics is that the brand company spends an excessive amount of money on marketing the drug, clinical studies, clinical trials. So the cost of the branded product is significantly higher than the generic product. The FDA and the World Health Organization monitors the adverse events associated with generic drugs. So these drugs, once they've been approved to be manufactured, they're also monitored for safety and efficacy as well. What are over-the-counter medications? Over-the-counter medications, also known as OTC or non-prescription medicines, can be purchased without a doctor's prescription. They are safe and effective if used exactly as directed and if you minimize the usage of them. Normally patients that are healthy, patients that are not on multiple drug therapies tend to do very well on over-the-counter medications. However, these drugs can still pose a problem or can still create a significant increase in the amount of adverse drug events if they are not handled appropriately. There are certain patient profiles that are at a greater risk for experiencing an adverse drug event from an over-the-counter medications. As I've mentioned, these are children, older adults, and persons taking more than one medications at a time. The same applies to over-the-counter medications and prescribed medications. The larger amount of medications that you're consuming increases your chances of an adverse drug reaction, an adverse drug event, or even a drug interaction. There are a few things that you should know about your medications. Always read the direction labels on an over-the-counter product. We'll get into what the over-the-counter label actually looks like. Measure the dose appropriately. This goes for over-the-counter medications as well. This applies to over-the-counter medications as well. Safely store and dispose over-the-counter medications the same way you dispose of unused and expired prescription drugs. And always, when you're adding an over-the-counter medication to your drug regimen, always speak to your pharmacist or your physician before doing so. If you look, I'm not sure if you can see this, but if you look at an over-the-counter prescription label, you would see on the back of the label, there's the information about the active ingredients. This tells you exactly what is in your product. It also gives you information to avoid certain adverse drug events as well. It helps you to avoid taking 2 or more of the same drugs within the same drug class. Okay, so this tells you exactly what is in the medication, what causes the pharmacological effects to occur. Then you have what we have here are the inactive ingredients. The inactive ingredients are very important. While they do not exert a pharmacological effect, the inactive ingredients can cause an adverse drug reaction, or they can cause an allergic reaction. So this information is very important. Patients who have allergies to certain drugs or certain excipients, which we call inactive ingredients, it's very important that you know the types of dyes, the stabilizers that are in your medication, and this on the label tells you exactly what is in your medication. The uses of the drug is also indicated on the product label as well. Always use a product that has the uses that are indicated for your symptoms. If you have nausea and vomiting, use that product. But if you don't have certain symptoms, for example, if you're using a cold and cough preparation, you don't have a stuffy nose, you don't have a cough, don't use a product that has those extra active ingredients. Always use a product that is specific to your symptoms or what you need from that product. The warning labels of a product gives you information to prevent drug interactions as well as harm that can possibly occur to you while taking these medications. It also gives you information about the possible side effects of a medication as well. May cause drowsiness. Do not operate machinery. All of this information should be at the back of your label. Always read a drug label in its entirety before you start taking a medication. Also, any other information that you may need to know about the effectiveness of the product is also indicated on the label as well. And that's pretty much how you read a drug label. Always read the back of the label before you start taking the medication. The directions of the drug, take 1 tablet every 8 hours, every 12 hours is also indicated on the label as well. This is pretty much how a drug over-the-counter medication label looks. Gives you the active ingredients, the uses, the warnings, the directions, some of the facts that can possibly be that you would possibly need to know about your medications, the inactive ingredients. While these, as I've mentioned, while these are inactive, they can still cause harm to you. So it's important that you know what is in your medications as well. Some of the things that you'd want to know about your medications while administering them at home would be how to properly measure your medications. Never use a household teaspoon or tablespoon when measuring medications. These do not deliver the accurate volume of medications that are required. Always use the devices that are provided to you by the manufacturer or your pharmacist. If you are dispensed a syrup or a suspension in the pharmacy, never leave the pharmacy unless you have some measuring device so that you can measure your medications accurately. When measuring the medications, always look at the medication at eye level. Do not look down into the cup when measuring the medication. Always put the medication at eye level or on a flat surface so that you can get the accurate volume of the medication. A lot of dosing errors occur when we measure medications incorrectly. There's a patient populations, the elderly as well as pediatric patients. It's very important that we measure medications accurately for these populations. One of the things that we want to know about, while we store our medications in the appropriate way, we avoid temperatures, excessive temperatures, we avoid excessive humidity. We also want to separate pediatric medications from adult medications to eliminate the possibility of administering an adult medication to a pediatric patient. And as I've mentioned, Do not combine any medicine with food unless you've been counseled by your pharmacist or instructed by your physician, because over-the-counter medications or prescribed medications, sometimes in some events, if they interact with food or drinks, can render the medication ineffective. Sometimes they can increase the effects of the medications and cause harm, or they can render the medications ineffective. And these are just some of the things that you should know about your medications. How do you handle medications properly to ensure that you maximize the benefits from your medications? And this is the end of the presentation.
You've been watching Doctors Hospital Distinguished Lecture Series, presented every third Thursday in the month. Thank you for joining us.